Okay, thanks. This is a full-term neonate with incidental liver mass on ultrasound. So here is the ultrasound of the liver, and you can see this patient has this heterogeneous mass here within the liver. I'll show you it on a couple still images as the clip goes through the right lobe of the liver. Has some significant vascularity, some prominent vessels within it, but it's heterogeneous with areas of increased echogenicity within this lesion. This patient went on to have a CT. And here is our CT, where again we see this large mass within the right lobe of the liver with enhancement around it and fluid or necrosis centrally within this large mass, taking up most of the abdomen. Here it is on those still images. Also notice on this lesion, if you take a look at the aorta coming down, here's the aorta here, and it tapers as we go down inferiorly after the mass. So the aorta is tapered, suggesting that it has a pretty large vascular flow to this lesion. And then I'm showing you this image. Doesn't project really, really well, but the hepatic veins are also enlarged as we go back to the IVC, so suggesting this is a large vascular lesion. This patient also went on to have an MR. Here it is on T2 weighted imaging, similar heterogeneous mass, similar to what we would see on CT. And then here is a post contrast. They didn't get multi-phase imaging on this study, so we've got a single. This is a subtracted image showing that enhancement with the areas that necrosis within the mass centrally. So this lesion was resected, and you can see it's a red, fairly pale vascular mass that was resected. Kind of came out very encapsulated, this lesion. And here it is on histology, where we see these endothelial cells kind of lining these different vascular channels of different sizes on histology. And this patient also was GLUT1 negative, which kind of gives away the diagnosis, since I'm telling you about the GLUT1 negativity in this mass. So here's just to show you from a radiographics article by Dr. Chung, who presented this lecture on these lesions. Just to show you, we're here in the middle. We have this GLUT1 negative lesion with the patient was asymptomatic, but it's a large mass with central necrosis and hemorrhage in this hepatic vascular malformation. This would involute at 12 to 14 months, as opposed to the multifocal lesions, which are GLUT1 positive, which proliferate, then involute. So this surely should have started to involute over time. And then the diffuse masses, which are more complicated and tend to replace the entire liver. So this is an infantile hemangioendothelioma, which is GLUT1 negative. This was submitted by Benjamin Bemont. So congratulations, Benjamin. And here is just the imaging feature showing the ultrasound with the vascularity, the heterogeneous mass with that central necrosis, and these endothelial, these vascular channels lined with endothelium and the gross pathology. So congratulations, Benjamin.